I'd like to introduce Dr. Charisse Berry and Dr. Carla Pugh. Dr. Berry is Associate Trauma Medical Director and Assistant Professor of Surgery at NYU Langone Medical Center. Dr. Pugh is Professor of Surgery at Stanford University School of Medicine and Director of the Technology-Enabled Clinical Improvement Center. They're co-authors of the paper, Benchmarking Accomplishments of Leaders in American Surgery and Justification for Enhancing Diversity and Inclusion, which was recently published in Annals of Surgery.
I would first like to thank the AWS for the opportunity to present our research findings and for the privilege of the virtual podium. So this is the changing face of America. And in looking at the racial breakdown of the country from 1950 to 2050, our country was 80% white in the 1950s, and by 2050, we will be a country that is about 47% white. And so is the changing face of America reflected in academic surgery? And so to answer this question, you really need to look at each point along the roadmap to leadership, starting with the pipeline of trainees. Are we training a diverse workforce? And so we evaluated the demographic trend of general surgery residency applicants, matriculants, and graduates from 2005 to 2018. And of the nearly 25,000 graduates of general surgery residency programs, only 10% were underrepresented minorities and 19% were Asian. And so for underrepresented minorities, the proportion of applicants, matriculates, and graduates remained significantly low and unchanged, while the attrition was significantly higher when compared to whites and Asians. And so, is the changing face of America reflected in academic surgery? Well, based on the data, we are not training a diverse workforce. Thus, with a homogeneous pipeline of trainees, we would really expect to see that homogeneity reflective within the surgical faculty. And so in looking at data from the 2017 AAMC faculty roster, when you look at the percent of women among all faculty stratified by race, the disparities are striking. And so when you look at academic rank for all medical school faculty within the Department of Surgery, you see that disparities. So of nearly 3,500 professors, 51 are Asians, 5 are Latina, and 10 are African American. So not only are these disparities in the diversity of medical school faculty present, but it extends through the promotion of female faculty of color. And when you look at the chairs of departments, those disparities are also quite striking. Out of nearly 337 chairs of surgery, 2 are Asian, 2 are Latinas, and 0 are African American. And so to date, there have been no African American woman that has ascended to the role of department surgery chair. So if we're not training a diverse workforce and the surgical faculty and department leadership is not reflective of the diversity of the people to whom they serve, would we expect to see diversity within the leadership of our surgical professional societies? And so we sought to answer this very question, to comprehensively assess the level of achievement and demographics of National Surgical Society presidents so that surgeons would know what to strive towards if they aspire to become a national leader in American surgery. So we looked at the demographics and education of the last 15 to 16 presidents of the American College of Surgeons, the American Surgical Association, the Association of Women Surgeons, and the Society of Black Academic Surgeons. So the average age of the presidents were significantly older for the ACS and for the ASA. And to better compare the groups accounting for this age discrepancies, the CVs of the ASA and the ACS presidents were reassessed at the time point corresponding to the combined average age of the AWS and SBS presidents, which was about 52 years of age. And so in looking at race, 81 to 87% of the presidents of the college and of the ASA were white, and 100% of the presidents from AWS were white, whereas 100% of the presidents from SBS were Black. And looking at gender, 81 to 94% of the presidents of the College of the American Surgical SBS were all men. In evaluating the credentials, 100% of the presidents from all 4 organizations were board certified and were fellows of the college. Regarding subspecialty fellowships, 80% of the AWS presidents and 94% of the SBAS presidents had subspecialty fellowship training, whereas the number was about 69% for the ACS presidents and 80% for the ASA presidents. ASA and the college presidents' average number of peer review publications was 236 and 257, but at the age of 57, again, the time point corresponding to the combined average age of the AWS and SBAS presidents, that number was 122 and 146. In looking at academic rank, 100% of the presidents from the college and from the American Surgical are full professors, and 80% of the presidents from SBAS were full professors, while 20% of the presidents from AWS were full professors. And this finding really highlights the gender disparity and academic rank that we just discussed earlier in the presentation. When you look at NIH funding, that was also higher among the presidents of the College of the American Surgical and SBAS when compared to the AWS. But again, that's the disparity that we have previously looked at. So we looked at NIH funding over the last 4 decades and really found that gender disparities were quite striking. So the gray line is the total number of surgeons funded, and the red line are the number of men who were funded, whereas the blue line is the number of women who were funded, again, over the last 40 years. So in looking at the department chairs, the gender disparities are also quite striking. At the time of this paper, no president of the AWS had ascended to the role of chair, whereas that was not evident at all for the presidents of the other societies. And the graph here represents the percent of women and African-American chairs of departments of surgery in 2008 and 2020. That number has increased for women, but has significantly decreased for African Americans. And again, for African Americans, this number includes only men, since an African American woman has yet to ascend to the role of chair. So the ACS and the American Surgical President CVs display unsurpassed scholastic achievement and are not equivalent, but the AWS and the SBAS presidents had comparable attainment. And women and ethnic minority surgeons are deserving of additional national leadership consideration, and as organized medicine pursues a more diverse and reflective physician workforce.
Thank you, Charisse, and thank you to the AWS for allowing us to share some of these results. I think as the data reveals, there is a lot of work to do. And I think the most important point here today is that we now have the data that can be shared and specific action items can be made based on this data. We are in an unprecedented time in terms of optics with respect to inspiring medical students and residents and fellows to become the next generation of leaders in surgery. And so it is imperative that we work diligently to have a workforce that is successful in reaching the highest marks and in similar proportions, such that those who are coming behind us can be inspired to join us in our great profession. So thank you very much to the AWS for allowing us the time to share this work. And we also are ecstatic to work with the AWS, the American Surgical, the American College of Surgeons, and SBAS to achieving our goals.